Of late, I've been hearing about black fungus. So, what is black fungus and how is it associated with the COVID virus?
So the black fungus, the technical term is mucor, and it is basically a normal fungus which is growing everywhere in nature. Unfortunately, when we are having patients who have COVID, there's a high chance of them being a undiagnosed diabetic patient because they are not diagnosed previously. There's a high chance that we miss that, and that would lead to a unregulated diabetic profile or a very high sugar level patient that will be. Secondary to which they will be at a very high risk of developing this kind of mucormycosis or the black fungus. So usually it affects goes through the nose and it will affect go into the eye and then into the brain. It's a very rapidly progressive disease. The patient can end up with starting with a mild infection of the nose. It can suddenly radiate into the eye. It can go involve the eye, and there'll be a puffiness of the eye, and then it can directly go into the brain. So mucormycosis or the black fungus is a very dangerous disease. It's usually seen in the later end of COVID and during the recovery period, and also after recovery it is noted. So people have to see and monitor that if at all the first presenting symptom is a pain in the cheek area and also a radiating pain into the eye. So kindly consult an ENT surgeon such that we can do an endoscopy and assess if at all it is mucormycosis, and we can tackle it early because the faster we address it, we can save their life.